And welcome to WizeUp. I'm Paul Arthur. Boy, it's going to be an interesting one today. Most of you know about the Alberta COVID-19 Pandemic Data Review Task Force and the report that was released on January 24th. Now, there's been lots of pushback from the medical community, opposition parties, and so forth. The Alberta Medical Association has described this report as anti-science and anti-evidence. Okay, so we're going to talk to Dr. Gary Davidson today. He was the chair of the task force. He's the former chief of the emergency department at the Red Deer, Alberta Hospital, and he's also an associate professor at the University of Alberta. So good to have you with us, Dr. Davidson.
Thank you for having me on.
And I know you're joining us on the road. You're in Washington D.C., so you probably got some jet lag going. And yeah. So hey, listen, why don't we start off with first of all maybe giving our viewers a bit of a big picture snapshot of what Premier Smith was asking the task force to do, and what was the goal of all this research.
Right. No, I appreciate that. So in November 2022, the Premier was just recently elected and asked the Minister of Health to strike a task force to review the data. And this is what people have to understand. It's to review the data that the Alberta government used to make the decisions during COVID. We were not tasked to review what the government decided to do. I wasn't there to review the government. It's just what information were they using. And so we looked at it. So where was it coming from? So the source of the data, who was resourcing it? So who is handing that data source over? How is it being analyzed? Who is it being analyzed by? Were they qualified to analyze it? Did they apply it correctly? And did it work the way they thought it should? And then review it all and to see, would we do it like that or do it differently next time? That's what we were asked to look at. The areas we were asked to look at and this was in conversation with the government. That is, we looked at, first was governance and data flow. How is the data flowing to the government or to the people that were presenting it to the government? This is what we have to remember, that the health information, the government, the elected officials they ask people to give them information, and from that they make decisions. So how did that flow? And so what was the governance of that? Who is dictating which data came? So that's the first chapter. Then we had a chapter on modeling. So when people say things like the vaccine saved millions of lives, that's depending on the modeling that they predicted was entirely wrong. In other words, they predicted that 1 million people would die, but only 2 people died. Therefore, we saved 998,000 people. Well, that's only true if your modeling is correct. But how do you know if your modeling is correct? So that's what requires triangulation. So you have to look at what we did compared to jurisdictions that are similar to us that did it differently, see what the differences are. Then we can sort of see if our modeling is correct. So we looked at modeling. We looked at non-pharmaceutical interventions. So masking, lockdowns, restrictions, all those kind of things. Did it work? And again, you have to triangulate it to other jurisdictions to say if it worked. Because if we predicted that 1 million Albertans were going to die of this, but only a few thousand died, then we're going to say we did a fantastic job, or we just didn't know how to predict. Who knows, right? So you have to triangulate it to other jurisdictions. And how did they do doing it differently, right? So then we looked at the regulatory bodies. So there's some question. People were saying that physicians, nurses, other people were being restricted in what they could say. And so were the regulatory bodies, so the professional colleges mostly, were they restricting people? Were they telling people what they had to say to you? Were they telling you what to do or telling you what not to do? So we looked at regulatory bodies. Then we looked at the vaccines, of course, and natural immunity. They're kind of two things that go together. So and there's no such thing as natural. Well, I shouldn't say that. When we say natural immunity, what we mean is infection-created immunity. In other words, you get COVID and you end up with immunity after. Compare that to vaccinations. And so you can't just say, oh, that's crazy to let it run rampant, and then whoever dies, and whoever doesn't gets natural immunity or infection-created immunity. Well, so then you say, well, then we use things like vaccines. Vaccines hopefully can confer some immunities, so we don't have to let it run rampant. That's why vaccines are created. So we looked at that. Did the vaccines work the way it should and all that? And then the last one is therapeutics. In Alberta, as many places in the world, there were certain things that were allowed, certain things that were done, and certain things that weren't allowed, and certain things were prohibited. And so we looked at that and the reasoning behind it, and why were those decisions made. So those are the areas. So we looked at the data and all the flow and how it worked, and we looked at it specifically in now each of those areas in each of these different categories. And so that's what the report came up with.
Okay, and then you made some recommendations out of that, right? So, all right, fair enough. Thanks for sharing the big picture there. And again, the Alberta Medical Association, the NDP, others, not terribly happy when it comes to your findings and your recommendations. Any thoughts from your end on why they'd be unhappy with this?
I can't comment on people's motives. Our report didn't talk about people's motives. We didn't
Right.
ask why or who. We just said what. And so, same thing to ask me what their motives are or why they would be unhappy. I'm not sure. I belong to the
Yeah.
AMA, and I know I have
Hmm.
many friends and colleagues who belong to the AMA that don't agree with that. So to say that the AMA said that isn't entirely correct. I understand the leadership of the AMA, or maybe the president said that, and that's fine. She's allowed to say that. To say that's unscientific, or I think that was one of the things, or
Yeah.
I can't remember. So
Anti-evidence. Yeah.
anti-evidence, correct. So we took all the evidence and we compiled a report on it. I'm confused how that's anti-evidence. So we took, if somebody takes the time to read it, there's hundreds of references from peer-reviewed medical journals all around the world, hundreds of them. So I'm not sure how that's unscientific or unevident. I don't. That confuses me. Then they used a term about a great international collaboration and what have you. That sounds a little bit like it could be a conspiracy. Like, so everybody got together and agreed this is what you could and could not do. I'm not a big fan of that kind of stuff. So if that's what they wanted us to do, we weren't doing that. We were going to look at the evidence worldwide and see what was used and see why Alberta did what they did. That I don't
Yeah.
know what
It
else.
sounds to me, like they don't like, some of the recommendations, so therefore it's, yeah, unscientific. I guess we need to. I'm glad you mentioned that because when you look at, a group like the Alberta Medical Association, again, all physicians in Alberta, I'm assuming, are part of that, and so but so when they make a statement saying, in the media that the Alberta Medical Association disagrees here and it's unscientific, that does not include all doctors in Alberta. Maybe it leaves the impression that that's the case, but that's not necessarily so. Now, now let me address, I guess, one of the other criticisms against you. That was back in 2021, I believe it was. You made some statements that hospital admission numbers were being exaggerated and manipulated, and that was to justify the need for public health restrictions. So I don't know if you want to comment, I guess, on your previous comments on that. Does that, I guess, disqualify you from being the task force chair here?
No. I commented on a public statement I made, and I see that there was a video that circulated back in
Yeah.
September 2021. That was a 4-minute recording that actually was edited. There were
Oh,
things in there I
wow.
didn't actually say, but most of it I said, and I'm not going to disagree with that. But there was a few sentences that were edited to say things that weren't actually said. Um, anyway, and that's fine. What I mentioned was is that I just came from work, and for all of 2020, anybody can, any of the doctors or anybody that has access to the data can go look, and I have pictures of it, of our visits. So, and I'm just talking about me. I wasn't talking about anywhere else or any of the other physicians that I talked to in other departments. I couldn't comment on general, but I said what I saw was we had 30% less visits in 2020 where I worked than we did in the years previous. So
See,
30% is dramatic.
that's shocking. But you're saying this is a statistically factual comment here.
You can't argue with a picture, and you can't argue with, they can go look at the data up themselves. To the point that we actually reduced our physician load because we were just standing around doing nothing. So I shouldn't, stand around doing nothing is a horrible term, but we typically at that point we had 7 physicians in a day. So we had 7 physicians. There were sometimes at night when they only have 1 physician, and sometimes during the day, in the evening, afternoon, evening, we had to have 4 physicians in the department. we actually decreased the number of physicians per day by one because we didn't have enough work. So you can't argue with me that to say that AHS, I can't remember the word they used. They refuted my claims. It's like, really?
Hmm.
They didn't even actually talk. They just say that, but don't actually say how they refuted my claims. They just say things like that, but they don't show anybody when they say statements like this. Well, these are the numbers, and Dr. Davidson, I don't know what he was possibly claiming because these are the numbers. I'm thinking, well, I have the numbers, and they've never said Dr. Davidson's numbers are wrong. They can't. They're on their computers and not on mine. So they can't refute. That was a claim that they refuted, which kind of made me chuckle. It's like, well, again, calling it anti-science. Science is taking the truth and saying something about it and analyzing it and seeing what we can do with it. Just making a statement isn't anything. It's definitely not science.
Yeah, we need to look at the evidence. And I recall actually there were a number of websites that actually did carry those stats from Alberta Health. AHS had those stats available to the public. And so when you look up the numbers, you could see that there were spots where, hospitals were not, fully to maximum. In fact, they not even close in some situations. So, and then that's not to downplay that there was a serious pandemic underway, but, were things exaggerated perhaps? And then we'd have to say why. Well, we don't know exactly why, but we can maybe read between the lines, right? A lot of us like to think maybe there is something going on, right? But okay, fair enough. That's not factual necessarily. But another thing that's coming up here, of course, in the media is that some of your recommendations were, controversial, I guess. The recommendation that vaccines shouldn't be administered unless the patient first has full disclosure of potential risks. I can't think of any other, medical procedure. That you wouldn't want to know what the potential risks are. All patients should always know the potential risks. But in this case, apparently there were situations where the risks were not shared with patients. Is that the fact?
Well, there was a little rumor circulating at the time that the monographs that came with the vaccines were blank, that there was nothing written on them. And I just, people say all sorts of interesting things during the time. And I actually wanted to see it myself. And unfortunately, there was nothing written on the monograph. So how could I possibly tell a patient these are the possible side effects? Well, the interesting thing about it was I had a keen interest in this because you have to remember that in 2020, we had a pandemic, we had no vaccine, and we had no excess deaths in Alberta.
Mm-hmm.
Our death rate didn't spike like a pandemic should have done it. So
yeah, that's really interesting. Could you just repeat that? I want to make sure our viewers actually understand what you're saying there. If it's a pandemic, you're saying, you'd see the number of deaths would go up significantly, right? You're saying that didn't change?
No, these numbers are public. So in 2020, we did not have a spike in unknown causes of death. We didn't have an increase in total deaths. You can look at the numbers; they are gradually increasing as our population increases, but there wasn't a spike. So to be declared a pandemic just before this pandemic came, it had to be where 5% of the population. You could lose up to 5% of the population. They changed that definition, and so that it didn't matter anymore. So in 2020, when we had no excess deaths, how is that possibly a pandemic? And there's lots of, you can argue that our pediatric deaths were down because we were locking down kids from school and things like that, and that's probably true. But if you want to look on another, dashboard part of the Alberta government, look at accidental deaths and overdoses in relationship to every time we lock down. Have a look at those numbers. So in April, we locked down first time middle, March 17th, I think, in 2020. Look at the massive spike in accidental deaths and overdoses.
Wow.
And those numbers have not come back to where they were. They've not come back to baseline again. People lost hope. So yes, it's very interesting that those numbers times dwarfed our COVID numbers, but nobody talked about them. So was the side effects of some of the measures we did worse? Was the medicine worse than the disease? That's the question we had. And, so in science, I can just present the facts and you can do what you want.
Well, I think there's certainly a lot of fear in the atmosphere, if you will. Every day on the media, we would hear reports of how many more people, were hospitalized or died of COVID. But of course, the way that was calculated was I think somewhat off kilter. I'm not sure if the study touched on this or not, but we all heard cases of people counted as COVID deaths, and the main cause was maybe a heart attack, that sort of thing, but they happen to have COVID as well. Extreme cases, a guy falling off a ladder and dying, but he had COVID, so it's a COVID death. These kinds of things, right? But how accurate was that? And it seems it was not terribly accurate.
Mhm. There was a public statement by our previous premier during the pandemic when our COVID deaths, as per listed, were in the thousands, and the statement was, but only, and I believe it was 400 and something. I don't remember the exact number. 400 and something were actually directly just from COVID. It was no other reason. So, and that would have been over 2 years. So
Yeah, and
that's
that's just misleading.
interesting.
Yeah.
Well, it's interesting at best. Yeah.
Yeah, for sure. Okay. Now, one of the other recommendations is that vaccines should not be given to healthy children and teenagers. And, some people take issue with that. Of course, we all love our kids, right? We don't want to see them dying of COVID. But again, the numbers seem to back up. Why would we, I guess, just randomly give out? I mean, I guess it's a fear thing. Again, want to make sure our kids are okay. But there were no big spikes in deaths or hospitalizations with kids, were there?
No. So
Okay.
so in Pfizer's own study, they didn't have any children that died of COVID. So they predicted that about 1 in a million children would die of COVID under 18. So this isn't just young children under 18. It's interesting in their own results and the surveillance data that followed. It showed that the number that got myocarditis, especially in the young males, was significantly higher than that. We also know that from previous history of myocarditis that a certain number of them are never have normal cardiac function, and it does overall your chance of shortening your life is significant. So that didn't add up, right? So we just have to look at the numbers and see. But there's a massive study done in the Scandinavian countries, and if people want to talk about science, this was done. This wasn't paid for by some right wing crazy group or nothing like that. This was funded well, millions of people involved, that showed that the risk benefit ratio was negative if you're less than 50 years old. So in those countries now, if you're under 50, unless a doctor writes a note saying that you absolutely need it, you've read the possible side effects, and that for some medical reason you think you need it, and the doctor recommends it, they don't give it to you. So that this is a group of countries. This isn't some fringe group somewhere. And so
Hmm.
there's whole countries following that. So we quote that in our paper and just say, so why aren't we doing this similar in Canada or Alberta? And why aren't we even pursuing that kind of a study? So that was our question. And so out of that comes a recommendation that be similar.
Yeah, okay. Very interesting. The report also recommending giving doctors more freedom to prescribe alternative therapies in future pandemics, saying health authorities were too restrictive when it came to using drugs like ivermectin or hydroxychloroquine. And these are not approved, right, by Health Canada for treatment or prevention of COVID-19. So, some people will go, hey, well, that's alternative, so that means it's quackery and so forth, etc. But we did see in the US and other countries around the world where, and again, there were lots of studies done, as I understand it, where they were getting good results. So, one of my concerns, I guess, Dr. Davidson, is, if the medical community is searching desperately for solutions to pandemic and is allowing pharmaceutical companies to rush experimental vaccines, right, because they didn't have the time to thoroughly see what the effects would be or side effects. And again, they had a guarantee of no legal liability along with that. And so why then wouldn't they allow medical professionals to experiment with drugs like ivermectin, for example, which have been around forever and generally speaking have been quite safe?
Well, ivermectin is so safe that it's over the counter in many, many countries in the world, and many more until COVID came along, and then it was taken off that. A little confused about that. I prescribed it hundreds of times, and had a number of people that were taking a fair amount of it, and caused a little bit of visual disturbance that would go away as soon as they stopped. That was it. And some people got a little nausea. That was it. And I prescribed it as guided. I wasn't giving them horse paste or whatever. This was a
Yeah,
prescription
yeah.
from a pharmacy, so it was done correctly. So I gave it hundreds of times. I can say without a doubt, you can walk into any corner store and buy 10 things that are deadly that you can just buy anybody, no restriction. And I'm talking Tylenol, Advil, Benadryl,
Right.
aspirin,
Yeah, yeah.
everything else, right? That is deadly. I can give you 30 days worth of ivermectin. You could accidentally take it all today and you'd be fine. So that's what they show the safety profile of
Yeah.
ivermectin. We call it the therapeutic window. It's so huge that you can massively overdose and it won't harm you. If you take 30 days worth of Tylenol, Advil, Benadryl, aspirin, or any number of things, I'm sorry, you won't, it won't go well. So, and those things you don't even need a prescription for. And now, if somebody had come out and said, it seems that these might cure COVID, you probably couldn't have got them over the counter. I don't understand entirely why. My ideas, but that wasn't my job just to give my ideas. My job was to look at the data and just say what happened and why wasn't one of the questions I had. So then we used some drugs, some medications like remdesivir, which was actually brought up during the AIDS pandemic a number of years ago, was shown to cause kidney failure in 53% of the recipients. So they withdrew it. Then all of a sudden it pops back up again as the cure for this. I don't understand that one, but then we were told we should do that one. But we couldn't use ivermectin, which is probably the safest drug I've ever prescribed in my entire life. People don't understand that 75% of the time I write a prescription for a child, it is off label. I do off label all the time.
Wow.
So, and the latest thing is we got Ozempic. You watch a hockey game and there's Ozempic ads zooming around the boards. Like, why? Why? That it's made now. The company that makes that, it's out of Denmark, is now I heard 2 days ago, it's the largest corporation in Europe now because of that one drug.
Yeah,
That
it's
does
not
not have,
designed to, it's actually not designed to lose weight, is it? It's designed, I think, for
no.
blood sugar, isn't
It's the diabetic medication, but the side effect profile isn't great, and it's worse if you're not a diabetic. But then I have people coming in every week asking me for it, and I had to actually go to the drug company's website, print off the side effect profile, give it to people, and say, "You have to read this. I'll talk to you about it next week, but you can't do this without knowing the side effects." But I can still do that and be fine. It doesn't make any sense to me.
Yeah. So your recommendation, I think, makes sense to anybody listening here going, okay, why wouldn't you allow, some experimentation at least to see if it's going to help people stay alive or, have less symptoms of COVID and so forth? It just makes no sense to me. I don't understand,
Yeah.
why that isn't changing. And again, this comes back to even the whole idea of why are we doing this, this task force, reviewing things with with the way things COVID-19 was handled. And looking at the data, well, Premier Smith wanted to get some different perspectives than just the mainstream, perspectives to see is there any way we can improve on this next time a pandemic comes around, and it will come around. So we want to be better prepared. And if you're going to be scientific, then you need to look at all the possibilities, not just the status quo. How do you ever improve, right? You got to be able to think outside of the box, at least from where I'm coming from. So, one of the recommendations is that Alberta should not automatically follow federal or World Health Organization recommendations. We'll just carte blanche, we're just going to say, do whatever they say, but rather adapt based on the local needs in Alberta. It's going to be different from one spot to the next. It shouldn't all be cookie cutter, right?
Correct. Yeah, absolutely. Alberta had I believe, and I've read it, a great pandemic response plan before that was thrown out the window in favor of one that was kind of told we needed to use.
Why?
And so the messaging flowed down from the federal bodies quite a bit easier through the method we used than one made in Alberta that wasn't connected to any overseeing body, it seemed. Again, I'm not talking about motives. I'm just saying this is what we found. And so it was discarded, and the one we used was tied very heavily into something above it. And so we're talking about data flow, right? And so this was the data flow. It just flowed down. But the problem with it is the one we had, that Lieutenant Colonel David Redmond was a huge part in building, looked at all aspects of community and society and economy and everything under the sun. And so this is what we were talking, when we locked down, we said, oh, I know, but we got to keep one person from dying, which it didn't actually do. But what it did do, it had huge economic impacts. People were losing their businesses, becoming hopeless,
Yep.
losing their families, losing their lives. Did we know that that would be a side effect? It wasn't even looked at. That's what it appears what happened. So you need a pandemic plan that looks at all aspects of society to make sure that you're counting all the costs. So you're not just saying, well, I don't want anybody to die of this, but I forgot that they might die of that. So
Hmm.
that's the plan we had. It was fantastic. We discarded it. We used one that was focused only on health, and we forgot everything else. We forgot about mental health in children. We forgot about
Yeah.
seniors, the mental health in the seniors dying alone, not having any visitors. It's
Yeah.
just, I
Oh, a
don't think it was
huge part of that, right? I mean, again, looking at how many people, postponed their surgeries and so forth because, we couldn't get into the hospitals out of fear of things spreading around, so forth. And of course, just general speaking, fear of maybe catching COVID, right? You also mentioned that we need better support for vaccine injured individuals, right?
Yes, I agree with you.
Okay.
And in our paper, in our report, there's a couple things in there that we talk about. One is Pfizer's own surveillance data that shows that very shortly after the vaccine rolled out, there's 44,000 injuries from it. And inside of that, there was 1,123 deaths, and most of them was in 4 days. This is Pfizer's own
Mhm.
surveillance data. We don't know the surveillance data from Moderna because they haven't done it yet. So that's using theirs. And the other one is CDC. So we know who CDC is. They had an app that they gave to 10,000 volunteers who got the vaccine. Please record all of your symptoms and anything that might go wrong. And from that data, that's called the vSafe data, that comes from the CDC, not anybody else. It showed that 7.7% of people required medical care shortly after getting the vaccine.
Wow. I'm
So,
not
so
sorry. I'm
that's
just looking I'm glancing at the clock here. Didn't realize we're that close to running out of time here. Oh, I got to leave it there. I'm so sorry. We need to do another show here. It's been so interesting. Thank you for, just speaking what you've learned here, and we need to learn from that and do better next time. Thank you so much, Dr. Gary Davidson, Chair of the Alberta COVID-19 Pandemic Data Review Task Force. Thanks for watching. You can check out other episodes at wiseup.ca.